Welcome to Elect Connect, a candidate forum brought to you by the Greater Bloomington Chamber of Commerce. I'm Mary Morgan, the Chamber's Director of Advocacy and Public Policy, and we'll be talking with Jeff Ellington, who's running in the Republican Party primary for a seat in the Indiana House of Representatives, District 62. Before we get started, I would like to thank our generous sponsors for Elect Connect. Without them, this work would not be possible. So a big thank you to German American Bank, Bunger & Robertson, the City of Bloomington, Hoosier Energy, Smithville, and Indiana University. And once again, we're going to be talking with Jeff Ellington. He's running in the Republican Party primary as a candidate for the Indiana House of Representatives, District 62. Welcome, Jeff. Well, I guess I'd like to start out by just asking you to tell us a little bit about yourself and why you're running for this office.
So I grew up in Bloomington. My parents owned a tavern and a restaurant in Bloomington. Now it's called the Irish Lion. I started a small business in high school, and it grew from there. Luckily, I needed something a little more permanent in my early ages, and I got hired for the City of Bloomington as a full-time firefighter. I was there for 28 years, and during those times also, starting back in the late 80s, I was very involved in local politics, helping out other candidates. Got involved myself, got asked to run in 95, got elected as county council 2 terms in a row, and that sort of started my interest in trying to bring my experience at a local level and now a state level to try to fix things that were broken or could be done, you might say, in a more efficient and cost-effective manner. So that's sort of how I began. Okay.
Well, I guess we'd like to start out with a question that relates to the current COVID-19 pandemic. What assistance do you think the state should provide to local businesses during this time?
Right now in my office, what I've been doing on a daily basis is working with small and large businesses in my district, giving them the proper advice and the best channels to either help through the state's offices, whether it's through Department of Workforce Development, or through especially local hospitals and regional hospitals throughout Indiana, making sure that they are paid in a timely fashion through Medicaid here at state level. Sometimes those entities maybe only run on a 30 days cash balance, which is not even good in good economic times like we've had. So there's a lot of questions. So what I'm doing right now is trying to find those services, those programs that will help businesses from small mom and pop shops to restaurants to large manufacturing facilities I have in Bloomfield and here in Bloomington. We seem to be doing a good job. The governor's doing a good job making sure those programs are there. He's hired a lot of extra employees to help all these enormous calls they've been taking daily. And all I can say is just be patient. And as always, in my district, I give my cell phone number out. I come to your business, I come to your front porch, given the distancing requirements we have currently. And so that's my job right now. It's just trying to make sure we find all those programs. I think so far we've been doing a great job. Luckily for us, the Republican legislature has been in Republican hands for several years. We've maintained that $2 billion surplus just for emergencies like this. Will it be enough? No, but had we not had that, and we would have went maybe with some amendments from Democrats, would have put us almost $1 billion in a hole. You can imagine if those amendments would have passed, the devastation of our budget we would have had. So luckily, under good fiscal conservative constraints, budgeting priorities, we've been able to stay afloat more and better than probably any other state in the nation.
Well, as you know, the state legislature is moving into a budget year. And the expectation is that revenues will be down because of the pandemic. Given that context, what areas would you prioritize for budget cuts? And what areas do you think actually need more support, not less?
I would say probably instantly across the nation, I think every governor is probably going to look at the total budget and probably put a percentage of cuts throughout, so everything is equal, through the budget process. I don't know if that's going to happen or not. I will tell you that as of the end of February, Indiana's revenue was above projections, what they had projected. Now, the fourth quarter of this budget cycle will be down, of course, and also will be the first and second in the next budget, which is after July. We'll have to pay attention to where our cash flow starts to begin, like in October, maybe November, and then we should get some sort of better revenue forecast of where we might have to make some shifts. But fortunately for Indiana, with our good conservative leadership, we've had that $2 billion surplus sitting there to help, and it's there, and we've been already pulling out some of the reserves the governor has. It's in his budget already that he can reprioritize, and we will do that again, I think, with that $2 billion surplus.
Okay. Our next question was submitted by one of our members, and they're wanting to know that in light of projected decreased tax revenues due to COVID-19, would you consider legalizing marijuana? Why or why not?
Well, I've got a unique background, and my dogs are barking behind me right now. I was on the Center for Behavioral Health board many years ago, went through some training with mental health problems, and back then, even 20 years ago, the problem we have with Indiana was the expense it cost us with drug abuse. And those programs and how much they cost, and they cost the community and businesses alike. I want to see any drug that's legalized go through the FDA process to make sure that it is properly vetted for those intended uses. And I've been to other states. You can walk about to any street corner before it was legalized and just tell the attending physician that I've got anxiety, I've got a headache, and they prescribe that drug. And I think in those states, it was overprescribed. We've had the problem here with prescription drugs, opiates being overprescribed. And I'm concerned that that same problem will occur with marijuana unless it goes to the FDA. And it's really vetted on those uses and the symptoms or the conditions each patient has. I'm not set one way or the other for it, but I just want it to be better vetted so we don't have the predicament we have now with opioids, where it's costing not only our community, our state, but our nation hundreds of millions and billions of dollars with lost wages and potential revenue and the added expense for our medical care.
Okay. So you are well aware of the tension that sometimes emerges between the state and local municipalities, particularly in Bloomington. What's your view of Indiana's Home Rule Act, and how do you determine when the state should step in and take action to limit local government?
Well, it seems that some communities throughout Indiana really have a lot of attorneys. They have a lot of time on their hands, and they try to push the envelope on state legislation. They try to take advantage of it and find loopholes. That's happened in Bloomington. It's happened in other communities. So it's not picking on one or the other. But my philosophy and belief is that as a Indiana citizen, we have a state constitution, which is really founded upon the U.S. Constitution with basic rights. And when government abuses those rights, intentionally finds loopholes to take advantage of a way a law was written, it's up to us, the state government, because the locals only rule with the ability of what each state gives them jurisdiction-wise. And if they overstep that jurisdiction, it's up to the state legislature to change that and pull those rules and legislation and words back into where there's no loopholes. Now, fortunately for me, that's what I've been able to do on annexation and some other areas with overreach, and I will continue to do that. But local control, I believe you should have local control, but at the point to where you really violate and try to find loopholes in state laws and take advantage of the situation, I think somebody's got to step in and listen to the constituents. That's what I've done. Constituents have came to me and said, you know, for this problem needs fixed or that problem needs fixed. And I'm not scared about fixing what's broken.
Okay. In many ways, state legislators have limited influence. How do you plan to approach your work, or how do you currently approach your work so that your constituents have a voice in state government?
Well, for me, my cell phone is on 7 days a week. Now, I've had some people call me 24 hours a day, you know, because the businesses I own, you know, emergency storm work for tree removal or emergency fires for demolition companies that we take down hotels and motels. Those happen at all hours. But sometimes I'll get a call at 1 o'clock in the morning from a constituent who's got a problem, and they really think they're going to get an answering machine, and I could call him back the next day. But I say, hey, they say, oh, I can call you back. And I'm like, you know, you've got me here. Let's talk and see what I can do for you now. And then I'll get to the office and make some phone calls and try to help you out in the morning. So I think being out in the community, you know, my district is about an hour and 15 minutes from side to side, from Bloomington through Salisbury, through Bloomfield, north to Worthington, all the way to the west side to Linton, down to Odin, down to the top part of Lagodi and Shoals, south side here around Lake Monroe in Bloomington. I'm out into the community, of course, not as much lately, but I miss the door-to-door right now, but you know, it'll come back. But that's what I do. I'm accessible, and I've taken a lot of comments from people. You know, they'll send me an email about a problem or an idea, and I take that to legislation, and I've done it in the past. And I think being there for me 7 days a week, that's my job.
Well, that concludes our questions. Is there anything else you'd like to share? Any final thoughts?
No, if you see any changes that might be necessary, if you have a small business, large, or a teacher, we've tried to work through and make some changes, like we've done a lot of changes to help teachers in the last session with iLearn, Hold Harmless, reorganizing their testing. I was able to also do my own bill this last session for public accountants statewide. They were limited on when they could take their test from other parts of the community or the nation. And my bill allowed that now to be a 12-month test period. So immediately when you get your diploma and you do some training and you meet those hours, you can now come to Indiana and get your test within a couple of days. And you can get right back to work. And so it's all about getting opportunity for your community, whether you live in Indiana, to have good job opportunity, good health care, and a good tax structure that saves revenue back in case we have a not only state emergency, but a national emergency, which we've done.
Okay.
So you can reach out to me anytime.
Great. Well, thanks so much. Again, to remind our listeners that we've been talking with Jeff Ellington. He'll be in the Republican Party primary as a candidate for the Indiana House of Representatives, District 62. Would like to give another thank you to our Elect Connect sponsors, German American Bank, Bunger & Robertson, the City of Bloomington, Indiana University, Hoosier Energy, and Smithville. And finally, a reminder to vote in the June 2nd primary election. All registered voters this year are eligible to vote by mail, and we would encourage you to do so. You can get more information at monroecountyvoters.us or on the Chamber's website, chamberbloomington.org/2020-primary-election. Thanks again for watching.